NEFIT's advice has changed, quite significantly since last Thursday, from kind of a version of level 3 plus, if we'll call it, to level 5 minus. Their own projections have obviously changed over the course of whatever it was, 72 hours, quite significantly. Do they think, is the advice, when you sat down and spoke to Tony Holohan, does he think that part of the reason for that is this new strain?
We think it's entirely possible. So, as with any good doctor, they won't say until they have the detail, and we have the test results from the National Virus Reference Laboratory. However, I've been talking to my counterpart in the UK, Matt Hancock. Our officials and our experts are talking regularly with their equivalents in London. The UK are saying they are becoming increasingly confident. They can't say definitively yet, but increasingly confident that this estimate that it's about 70% more contagious or more transmissible is about right. And as you say, the speed this is moving is such that NEFIT's advice, the letter that Dr. Holohan wrote to me on Thursday evening, said move to level 3 from the 26th. And the letter that he wrote to me yesterday said move to level 5. That's how quickly this is evolving. And he and I and many people in government obviously were working through the weekend and trying to stay on top of it as it evolved.
Despite the fact that it's here, we've still taken these measures to prevent travel between Ireland and England. Those measures are going to continue in place until the 31st, until New Year's Eve, and then they'll be reviewed. So they might stay in place after that. They might be lifted. How disappointing is it that we've put those measures in place, but if someone wants to come to Dublin or Cork or Galway or anywhere else from the UK today, they can simply hop on a plane and fly to Belfast?
Look, I hear you. That is what it is, though. That's part of the political reality of Ireland and Northern Ireland and the UK.
Oh, I accept that, and I know there's nothing you can do about it, or the government here can do about it. But at the same time, it must be infuriating to put these measures in place. If Cork said no, we're going to keep flying, you'd be pretty infuriated.
Look, my view has always been, and I think most people's view is that the disease couldn't care less about the Battle of the Boyne or anything else, that ultimately the closer we can get to an all-island response to this, the better. However, we're
a long way from that, I would say. If judging by the last couple of days, we're a long way from an all-island response.
Well, we certainly move closer. We certainly move closer today. So the Stormont executive is moving on the 26th, as are we. They're putting in place very serious measures, as are we from the 26th. So actually, from the 26th, later this week, it will be closer. But when it comes to travel bans between Britain and Northern Ireland, obviously there are unique political and cultural considerations there. All we can do is put in place what we think is appropriate here in the Republic, and that is the decision we made today to extend the travel ban to the 31st, and then we will review it from there. Can I just say as well, by the way, Kieran, in case there's anyone listening who has come in here from Britain in the last 14 days, so what we are asking is that you need to self-isolate. This is the advice I have from Dr. Holohan, is to self-isolate for 14 days from your day of arrival. Previously, if you got a PCR test after day 5, you essentially could relax the self-restrictions. What the public health doctors are saying is you've got to keep self-isolating for 14 days. And if you've come in, please get in touch with a local GP and arrange a PCR test, and that will be done for free and arranged for you.